per unit time, okay? So this is the definition of velocity, the number of substrate molecule convert to product per unit time. And most of the time, this unit time is minutes. It's not second, it's not hour. This is minute. We have some factors that can affect the velocity of reaction. For example, substrate concentration, enzyme concentration, temperature, and pH. This is the procedure effect of substrate concentration on a velocity. If I If I plot velocity of reaction against substrate concentration, are you familiar with the concentration? Tarkiz, okay? Am I right? If I plot substrate concentration against velocity, we have two forms of curve. I think in a protein session, you review this type of curve. Hyperbolic, the blue curve is hyperbolic, and the green curve is a sigmoidal curve. Do you remember where did you see? Sigmoidal, hyperbolic, in a protein session. No? In hemoglobin, oxygen saturation curve. Do you remember? Why you say no? Okay? This is very, very important point. Sigmoidal, hyperbolic. If you remember, for myoglobin, the curve was hyperbolic. But for hemoglobin, this is a sigmoidal. Why you say sigmoidal? Sigmoidal, what does it mean? It means that the curve is like a S. This is the first letter of sigmoidal, S. Okay? As I mentioned, for hemoglobin, if you remember, you have a sigmoidal curve. And also for myoglobin, you have a hyperbolic, if you remember. Also, about enzyme, if I plot substrate against velocity, but this is a reaction velocity, we have a different curve. One of them is for enzyme, follow the mechanism and kinetics. What does it mean, kinetic? Kinetic is a field of science in biochemistry when we are studying the effect of different factors like a substrate, like an enzyme concentration, like a temperature, like a pH on an activity of enzyme. Okay, I want to repeat. When you study the effect of some factors like a substrate concentration, like an enzyme concentration, or pH or temperature, on the rate of reaction or velocity of reaction, this is known as a kinetic. For example, now I want to show the effect of substrate concentration on a rate of reaction or velocity. Rate means velocity, okay? It is a one kinetic study. Do you understand? Kinetic. Most of the enzyme follow mechanism, and I will show what is the formula. But allostric enzyme, they have a specific curve. As you can see here, this is the sigmoidal curve, okay? This is related to the allostric. Allostric, I will explain what does it mean in the next slide, but show that. I want to ask a question. This curve, what does it mean? It means that following the increased substrate concentration, the velocity also increase and rise. Is it clear? For example, if I added one substrate, this is rate. 2 substrate. For example, if I add a 10 substrate, the rate is this point. Gradually, step by step, when you add substrate, the rate of reaction increases. But as you can see here, when I added more substrate, we reach to the one plateau. Plateau means a straight line, okay? Means that plateau means that there is no change, no decrease, no increase. This is a plateau. And we reach to the maximum velocity. Why the rate does not increase? What do you think? For example, the number of my enzyme, okay, is limited. For example, these are enzymes. When I add a substrate gradually, substrate added. When you add a substrate, is there any free enzyme? No. It means that you have a saturation. Okay? It means that all of the active sites are full. Okay? There is no empty enzyme. So we reach to the maximum velocity. Is it clear? Because all of the enzymes are saturated. The name of the curve is curve means one hand.
Yes.
Okay? Curve. The name of curve is saturation curve. Question. If I ask you, what are the components of the plot of saturation curve? One of them is components means that the y-axis and the x-axis. This is the x-axis and the y-axis. Okay? Components means that the name of y and x-axis. You should know that velocity of reaction against substrate. This is not enzyme concentration. This is not pH. This is not temperature. You understand? And why we say saturation? Because whenever I add more substrate, no enzymes present. Okay? So we have a saturation curve. But if I draw a velocity against enzymatic reaction, if you have a one condition, it means that you have a lot of substrate, you have a straight line. Okay? So, following the increase enzyme concentration, the rate of reaction also increase. Okay? If you have a sufficient, for example, if you have a limited substrate and gradually add enzyme, for example, 1 enzyme, 2 enzyme. If you have a limited substrate, again, the curve became plateau. But if you have an excess substrate, you add more enzyme, more rate. Is it clear? Okay. But what about the effect of temperature? This is a belly-shaped curve. Why it is belly? It means that we have the optimum temperature. What is the optimum temperature of our body? Normal temperature. How about 37. Between 36 and 37. As you know, fever is very dangerous. Okay? Fever is very dangerous. Why? Because in its temperatures higher than 37, it can cause damage to biomolecules, like an enzyme, like a carbohydrate, like a proteins, okay? So, as you can see here, by increase, as you can see here, when you increase temperature, you increase the rate of reaction and velocity. But we have an optimum. After that, further increased temperature causes decreased velocity, as you can see here. Okay? Because at this temperature, all enzymes are defective. كلهم are معيوب, mixed up Arabic and English. It means that in a high temperature, the proteins loses their function and loses their structure. So we have an optimum temperature. Why, for example, following the increase of temperature, the rate of reaction increase? Because if you increase the temperature, you increase the kinetic energy. Are you familiar with potential energy and kinetic energy? For example, if you increase the temperature, you can increase the collagen between molecules. Exactly like happened in a boiling water. Okay? It's exactly like happened inside the boiling water. They increase the contact between molecules. Okay? So what to the specific temperature? What is the specific for human? Is 37 degrees. What can we say? This is just for more information, okay? About the Q10, okay? This is for your level. It is a rate of reaction increase following each temperature, each degree will increase. It can affect how the rate of reaction. But, for example, for the temperature, we say that we have one optimum temperature. Can we say we have one specific pH for all the enzymes? No. Who can give an example?
Pepsin.
Pepsin is a...
work in the pH 2.
Excellent. So it means that pepsin is an acid, a stable enzyme. Okay, so the pH optimum for pepsin is 2. What about, for example, other enzymes like a kinase and other enzyme? Neutral pH. What is the physiological pH? 7.5. Near 7. Okay, we can say 7.2 to 7.4. Okay, this is a physiological pH. And do we have any enzymes that are active in an alkaline environment, basic environment? Trypsin. Which organ secretes trypsin? Pancreas. Okay? Most of the enzymes that's secreted from pancreas are active in a basic solution. Okay? So, for example, on entering, for example, I want to review the digestion of proteins. Okay? When you take protein, the digestion will start in a stomach. In an acidic environment, pepsin is stable, digest the protein. And polypeptides sent into the small intestine, okay? In small intestine, we have a secretion of pancreas. Pancreas not only secreted digestive enzyme like a trypsin, like a chymotrypsin, okay, but also secreted bicarbonate. Pancreas secreted bicarbonate. What is the nature of this molecule? This is a basic or alkaline molecule. So, trypsin active in a base pH, pepsin active in acidic pH, and most of the time they are active in a neutral, near 7. Okay? About the Mikhail-Menten kinetics, Mikhail-Menten were two scientists who explained the kinetics of enzyme. We review enzyme plus substrate for the transition state, produce the enzyme product. I want to explain this equation. This equation is very, very important, okay? For a few seconds, focus on this formula because I want to use it for the next slide. Focus and try to memorize this formula. V0 equal Vmax times substrate in the numerator, in the denominator Km plus substrate, okay? This is it, please, maybe I give you several equations and I ask you to find the correct. For example, Vmax equal V0 times S. Is this correct? No. V0. I'm talking about this point. For example, if I give you this formula, Vmax, I don't know, equal V0 plus substrate or blah blah. Okay, is this correct? No. So please pay attention to each component of the equation. In continue, I want to introduce, now you are familiar with the V0. What is the V0? This is the velocity or rate of reaction at the beginning time. Okay? From the start point. It's known as the initial velocity, or actually the velocity of reaction that we measure at the start point of our reaction. Vmax is, do you remember? This is a saturation curve. Do you remember? V0, whenever we reach to the maximum velocity, is known as a Vmax. You are familiar with this? I want to explain the Km. Recall that in an oxygen dissociation curve of the hemoglobin and myoglobin. Recall the hemoglobin session. I think Dr. Khalili explained the P15. Do you remember? P15. In an oxygen dissociation curve of hemoglobin, for example, if that was 100 and that was 15, and this is the pressure of oxygen, and this is known as a P50. Do you remember? Who can define the P50 in hemoglobin? Ya Allah, how you can pass the exam? P50 was the pressure of oxygen, and which half hemoglobin molecules were saturated. Okay, for example, if you have it for hemoglobin, P50 is the pressure of oxygen and which half molecules are free, half molecules are full. Okay? Do you remember? P50, okay? But about the Km, at first, please pay attention to this definition. Km is exactly substrate, okay? Km yani substrate concentration, okay? Please hold in your mind, Km yani substrate concentration. But which concentration? Km is the substrate concentration at which you have half Vmax. Do you understand? Yes. So Km is the substrate concentration at which we have a half Vmax. What does it mean? For example, I want to find, I have two enzymes. Enzyme 1, enzyme 2. Km for enzyme 1, if I find the half Remax, for example, if it is 100, at first I should find the 15 and find the intercept. Intercept means in Farsi we say taqato. I don't know. Taqato, am I right? Intercept with the curve. If I find this point on a x-axis, this is the substrate concentration Km at which we have a half Remax. Do you understand? For example, maybe this is number, for number 1 enzyme, this is 1. Maybe for number 2, this is, for example, 5. What does it mean? You should know that Km shows the affinity of substrate to enzyme. Affinity. Are you familiar with the definition of affinity? Affinity means that, for example, I love substrate. I like it. Okay? But there is an indirect relation between Km and affinity to the substrate. For example, when you have a small Km, like here, for enzyme number 1, please pay attention. Number 1 enzyme, a small Km. It reflects a high affinity. It means that enzyme 1 loves its substrate. Okay? But about larger Km, low affinity, I didn't like. Okay? So it showed the affinity to the enzymatic reaction. I want to, please help me to write this box is very, very important. And one of your questions would be from this box. This is very, very important. Okay? And I want to show how we can reach to this equation. Please help me. I want to write a Michaelis-Menten equation with a loud sound. Okay? Help me. Michaelis-Menten. V0 equal excellent. Vmax substrate excellent plus substrate. This is a Michaelis-Menten equation. I want to review these 3 important sentences. I mentioned that at low substrate concentration, please follow me because this slide is very, very important. And at least, okay, one of your questions will be from this slide. So, whenever the substrate concentration is very low, I'm talking about this point. The substrate is very low. For example, half molar, for example, the concentration unit is molar, okay? If the concentration is very low, I mentioned that the Michaelis-Menten is V0, Vmax over Km times S. How we can reach to this point? Whenever the substrate concentration is very low, I can ignore in a denominator. Do you understand? Yes. Because it's very low, small, okay? So, Vmax, V0 is equal Vmax over Km plus substrate, times substrate. Do you understand? Yes. So, again, V0, Vmax, substrate, Km plus substrate. I want to read the second sentence. At high substrate concentration, I'm talking about here. Please do not pay attention to this definition. According to the curve, please tell me, whenever the substrate concentration is very high, the velocity is here. Vmax. formula? Okay, the substrate is very, very high. So I can ignore Kn when the substrate is very high. So, for example, maybe substrate is 1000, Km is 5. I can ignore. So, I can ignore the Km. Am I right? What is the remaining? V0 equal Vmax S over S. So, according to the mathematical rule, I can remove S to S. So, V0 equals Vmax. Do you understand? Yes? But I want to review the last part. Whenever, as I mentioned, again, V0 equal Vmax times substrate over Km plus substrate. I mentioned that I'm talking about this point. When substrate concentration is exactly equal Km. I'm talking about here. Am I right? It's wrote V0, Vmax, half Vmax. How I can show you this point? How we can show this point? Who can tell me how we can put in this formula? Whenever substrate concentration is Km. It means that I can replace Km with substrate. Am I right? Because I mentioned that Km is equal substrate. So I can substitute it, change it. Okay? So what is the result? S plus S means 2S. Can I omit from numerator and denominator? What is the remaining? V0 equal half Vmax. Is it clear? Yes. Please review this slide. And especially for the inhibitors, when we are talking about inhibitors, it's better to determine the exact amount of Km and Vmax. But you should know that according to the mathematical rule, curves are not very good represent. They cannot present an exact value of the, for example, Km or Vmax. For example, by this curve, I cannot take an off Km is exactly, for example, 0.05 molar. Okay? If I want to determine the exact value of the Km or Vmax, it's better to change the curve to the straight line. As you can see here in Mikhail's mention, the component is V0 and substrate. If I draw a reciprocal, it means that I change the V0 to 1 over V0, S to 1 over substrate concentration is known as a double reciprocal. Reciprocal in Farsi means macrus. I don't know. Okay? The reciprocal. So, especially for the inhibitors, what is important to know? If I ask you, this plot as first, the name of plot is important, Lindbergh, and also the slope is important. Okay? You know that if I draw one, reciprocal velocity against reciprocal substrate, the slope is Km, please hold in your mind, over V max. Okay, in this slide, this point is very important, okay? But how can I use it? These are some definition, okay? This is for more information, okay? some definition about the activity of enzyme, specific activity, okay? For your level, there is no need to memorize it. What about the inhibition? We can control the activity of enzyme. We can inhibit the activity of enzyme. What about the classification? We have non-specific and specific. Most of the time, we focus on a specific. In a specific, some binding is reversible, some binding is not reversible. Irreversible means that diamond, okay, permanently. But reversible is transiently, okay? About reversible, we have a competitive and non-competitive. I want to review. When we say competitive, what does it mean? How do you think about it? Competitive. Please pay attention to this figure. How we can explain the competitive inhibitor? This is the active site, okay? Who can explain? What do you think about competitive inhibitors? Inhibitors are molecules that control the function of enzyme. What do you think about competitive?
That means the drug can't work anymore.
Yes.
It's take inside the member of enzyme or something like that.
Yes, yes.
So what does that mean? The enzyme can't work anymore in enzyme.
Yes, and what about the binding site of the inhibitor and substrate? Is it the same or different?
Same.
Same, okay? When we say competitive, for example, this chair is enzyme, okay? And here is the active site, okay? Depend on concentration of enzyme or other person as the inhibitor, we can compete to each other to sit on active site. So the first point about competitive inhibitor is that the binding site of inhibitor and substrate are same. Okay? So whenever inhibitor bind to the active site, it means that they can affect the affinity of enzyme to the substrate. Do you remember about the affinity of enzyme? We have a one definition, Km. Do you remember? Km is depend on an active site properties. When active site, for example, I'm inhibitor, okay? For example, I am inhibitor. When I sit on an active site, so I can change the affinity of enzyme, for example, to the substrate. How can I affect this affinity? At first, as I mentioned here, inhibitor exactly can bind to the site of the substrate. And following the binding of inhibitor, EI, instead of ES complex, EI complex is formed. Is it clear? For example, this is free enzyme. This is, please pay attention, this is substrate, for example. And this is inhibitor. As you can see here, they are very similar. Only a few differences present, and small difference present in the structure of substrate and inhibitor. They compete to each other for sitting in an active site. Is it clear? So, sometimes, for example, if it is enzyme, sometimes EI form or ES form, depend on the concentration of the inhibitor. So, as you can see here, the blue curve is inhibitor, the Km of the no inhibitor. But what about when inhibitor is present, Km? For example, one of the very, very important questions, not only for your final exam, but also for your basic science exam, inshallah. Whenever the designer asks you, in the presence of competitive inhibitors, Km blank, decrease, increase, no change. In a competitive inhibitor, Km of enzyme decrease, increase, or unchanged? Why decrease? I'm talking about the red curve. Ahmad. This curve is with enzyme inhibitors, this with no inhibitors. So, in a presence of competitive inhibitor, Km will decrease. For example, if it is 1, it is, for example, 3. Not change, I will kill here. Increase, clear. So, if the designer asks you, in a presence of competitive inhibitor, Km increase, as I mentioned here. What about the Vmax? If I continue the adding of substrate, finally I will reach to Vmax. Okay? So Vmax is constant, but Km increase. It is clear? I want to change my question. Maybe the designer asks you, please pay attention. In the presence of competitive inhibitor, affinity of enzyme to substrate is decreased, increased, constant. At first, think about it. Affinity of enzyme to substrate. Okay, I know that in a competitive inhibitor, Km increase. So affinity decrease. Okay? So there is an indirect relation between Km and affinity. Okay? When Km increase, affinity decrease. What are the examples of the competitive inhibitions? Have you ever heard the name of statins as some anti-lipid drugs? Statins. Do you have any family members who take statins for lowering cholesterol? No? Alhamdulillah. No? Alhamdulillah. Statins. Did you review the lipid session or not? Yes, lipid session. What's cholesterol? Cholesterol is one kind of lipid. You should know that 70, please pay attention, 70% of cholesterol is synthesized inside the body. Okay? So, if I have a high cholesterol level, I'm not a lucky person. Okay? Because this is a genetic problem. Okay? If you have a high triglyceride, you can control the fast foods. I don't know, watch everything like that. Okay? Kebab, anything like that. Because they are full of triglycerides. Okay? But in cholesterol, if you control your diet, you can control only 30%. Okay? In a diet. Okay? Only 30% originated from diet. 70% of cholesterol, okay, produced inside. So, if I have a high cholesterol, it's better to inhibit the biosynthesis. We have several reactions. Finally, we reach to the cholesterol. Please follow me. Okay? We have a several reactions to finally biosynthesize cholesterol. If I want to inhibit the production of cholesterol, I have one key enzymatic reaction, and the name of enzyme is HNG-CoA reductase. Okay? HNG-CoA reductase. If I want to inhibit the production of cholesterol, I have to inhibit this reaction. What is the name of inhibitor? Atorvastatin and pravastatin. Okay? So, what is important in this slide? At first, you should know that statins are example of competitive inhibitors, the name of the enzyme, and also the anti-hyperlipidemic drug. In this slide, please memorize this point. If I ask you, for example, inhibition of HNG-CoA reductase by a statin belong to which inhibitors? Competitive, non-competitive, uncompetitive, or irreversible. This is a competitive, okay? So this is some sample question about the inhibitors. Another example of the competitive inhibitors, just know that methotrexate is an anti-cancer drug by inhibition of dihydrofolate reductase belong to the competitive inhibitor. To be honest, actually in this slide, these three phrases are important. Methotrexate is a competitive inhibitor. What is the name of enzyme inhibit? Dihydrofolate reductase. Inshallah, in a vitamin session, I will explain it for you. And the name drug is methotrexate, competitive, and the name of the enzyme. Okay? We have another example, also competitive. The name of the enzyme is a succinate dehydrogenase, and the name of the inhibitor is a malonate. This is the enzyme, this is the inhibitor, and this is the type of inhibition. Do you understand? These examples are very important. Also, we have another type of inhibitions. We have a non-competitive. Would you please review this shape and compare it with the competitive? Who can tell me what is the difference? How do you think about competitive and non-competitive? I want to show it again. This is non-competitive. Please pay attention. And that was competitive. Who can explain? It's very simple. The location of what? Excellent. And inhibitory. Excellent. As your friend mentioned, the difference between competitive and non-competitive about recall competitive in a competitive substrate and inhibitor, both of them bind to the active site. But in a non-competitive, it means that there is no competition. Non-competitive, no competition. We have a other site rather than substrate. I mentioned that again. This is the enzyme, and here is the active site. Please tell me. I recall that I mentioned in a competitive inhibition, when inhibitor sits in an active site, I'm inhibitor, I sit on active site. So I can, as an inhibitor, I can change the Km and also affinity of enzyme. Do you understand? But in a non-competitive, okay, I cannot sit here. Okay, maybe I bind here. This is the active site, I'm inhibitor. So please tell me, in the presence of non-competitive, Km decrease, increase, constant. Excellent. Is it clear? Okay. And also, for example, if I want to change my role and I want to become enzyme. For example, I'm enzyme and my hand is an active site. Whenever non-competitive inhibitor wants to bind, for example, non-competitive bind to my leg. Okay? So, in the absence of inhibitor malformation, okay? The rate of reaction is very high. But in the presence of non-competitive, for example, inhibitor, I take my substrate, okay? For example, this is my substrate. I take my substrate, but non-competitive bind to my leg. So the rate of reaction is low. As you can see here, the Vmax in the presence of inhibitor decreases. This is the rate of reaction, okay? So, Vmax in the presence of non-competitive decrease, but Km is constant. About the example, just know that we have one drug. These are not very common inhibitors. Competitive are very common. But about non-competitive, we have one important drug, oxoprenol, is a non-competitive, as I mentioned, type, and inhibited xanthine oxidase. Okay? For the person who suffers from gout. Have you heard the name of gout? It's a disease. It's a luxury disease. It is found in a person who a lot meat. Have you ever heard? In Farsi we say naqres. How can I? Accumulation of the some urate inside the joint. They have a very, for example, inflammation or swelling inside the joint of the fingers. Okay? Forget about it. I cannot explain it more. So, this is the drug for growth treatment, and the name of the enzyme that inhibited is xanthine oxidase, and the type of inhibition, this is a non-competitive inhibition. About the reversible, we talk about it, but sometimes we have some irreversible. Please pay attention. Irreversible. Some metal ions, like also oxidation agents, oxidizing agents, belong to this type of inhibitors. What are the examples? Lead as a one metal. Okay. Can bind, for example, this is an enzyme. At the active site, we have a one SH group or sulfide group, and this lead can bind to this enzyme. What is the name of this enzyme? This is a ferrochelatase, and it can inhibit the enzyme. And many drugs, like aspirin, inhibit cyclooxygenase. They are important in inflammatory reaction. Antibiotics, penicillins, amoxicillins, they bind to the enzyme. Please pay attention, you should memorize the name of enzyme. And these are inhibitor. Okay? So these are the main important points you have to memorize about irreversible. Maybe I ask you about the name of the drug and the type of inhibition. For example, if I ask you, is it correct or not? Aspirin considered as a competitive inhibitor. No, this is irreversible. Okay, it's not related to the competitive or non-competitive. Okay, or for example, you should know that lead as an inhibitor can consider as an irreversible inhibitor. Okay, these are some points you should memorize. And this is the action of the penicillin, mechanism action of penicillins. In an enzyme, the name is a transpeptidase. Okay? We have one. Do you remember the structure of the amino acids? In your final exam, I know, maybe Dr. Khalili asked you to find the amino acid hydroxyl, actually containing amino acid. Do you remember? Hydroxyl containing amino acid. Do you remember? Serine, threonine, tyrosine. You should be familiar. Maybe Dr. Khalili asked you find the basic amino acid. Lysine, arginine, histidine. Acidic amino acid. Glutamate, aspartate. Okay? You should memorize all these points. These are the most simplest example question. Okay? So, if you remember some amino acid like serine, in the R chain they have a hydroxyl group. And this hydroxyl group can bind to the inhibitor, and so the transpeptidase inhibited, so we can control the growth of bacteria by some antibiotics like penicillins. And about the irreversible example, another example, we have some drugs like the captopril and enalapril. These are anti-hypertension drugs. Okay, we have, for example, maybe some of the member of your family have a high blood pressure. Okay, how we can control it? By some drugs. Okay, what are the examples of the drugs? For example, captopril from Seyed Ali, you can buy it. Captopril and enalapril. What is the reaction? What is the function? We have one important enzyme, disease. You should memorize the name of this enzyme. Angiotensin converting enzyme and the abbreviation. This enzyme converts angiotensin type 1. This enzyme converts angiotensin type 1 to type 2. When I were a student, when I want to memorize it better, I mentioned that, okay, angiotensin type 1, angiotensin type 2. Okay, type 2. Okay, it means that it can cause a vasoconstriction. انقباضات عروق. Okay? انقباضات. Constriction means انقباض. Okay? Vessel constriction or blood vessels. You know? Or arteries. So, by this way, angiotensin 2 increase the blood pressure. Okay? So, angiotensin 2 increase blood pressure. If I want to control blood pressure, it's better to inhibit this enzyme. When I inhibit, so angiotensin cannot produce, so you have a normal blood pressure. Is it clear?